Hi, my name is Jacob Greene. I'm a 24-year-old. I have cystic fibrosis, and I grew up in Washington State and went to college in California at Stanford, and am now a first-year medical student at University of California, San Francisco. So my medical regimen before starting modulators a few years ago looked a lot different than it does now. On an average, day-to-day basis, I do about 30 to 45 minutes of medical treatments in the morning, which include aerosolized medications and a shaker vest. And I would do about 30 to 45 minutes of those same medications in the evening, along with pills for digesting food and some vitamins, etc. And despite all of those medications that I would take, I tried to not let it stop me from living the life that I wanted to live. I was involved in track and with robotics in junior high and in high school. I also was part of the Boy Scouts and would go on fun adventures and hanging out with friends, and tried to live life to the fullest. So when modulators first came out, I was in college, and the first few modulators didn't affect my day-to-day medical regimen significantly, but it did affect the amount that I had to go into the hospital for pulmonary exacerbations, which was great because when I was in high school, I probably averaged between 1 to 2 inpatient rounds of IV antibiotics every year to year and a half. And then in college, that frequency was able to go down. And so that allowed me to enjoy my summers more. I didn't have to spend time in the hospital with the PICC line. I was able to do research in the lab that I was a part of as an undergraduate. And now, with the most recent modulator that came out, my medical regimen has come down pretty substantially. I only do about 20 minutes of medications per day total in the evenings. And I'm able to do, keep up with medical school, no problem, I guess, at least in regards to my medications. And I'm able to be involved in different student groups and do research, as a medical student. So in thinking about the role of parents for infants and newborns, I think the role really changes as your kid, gets older. Obviously, I don't remember what my parents did when I was first born, but there's a lot more of direct caregiving, seeing as how you're the ones that's having to provide the medications, the pills, etc. And so I think that knowing that it's okay to learn and it's okay to mess up and to kind of give yourself the grace to learn to administer these medications to your kid is very important because things can seem very life and death, and if I miss one thing, then what will happen to my kid? And so just giving yourself the grace and permission to learn to find a schedule that is works for you and your kid is very important. As your kid gets older and takes ownership for their own medical regimen, I think helping to transition that caregiving role from one of you're giving the medications to the kid to empowering your kid to doing the medications on their own is really, really crucial, and something that my parents did a really great job of doing. It kind of was a transition where over time I would assume that responsibility myself. It wasn't just one day, ready, go, all of this is now your job. Teaching your kid how to do their medications, how to do their nebulized medications, how to take their pancreatic enzymes, etc. And then even further down the road, when your kid becomes an adult, I think the last frontier is to transition. How to take care of yourself medically, but how do you go about scheduling medical appointments? How do you go about if you need IV antibiotics, how do you spend time in the hospital by yourself? How do you organize all of that from an insurance perspective, from a caregiving or a physician perspective? It can be very difficult to navigate, and is also something that my parents did a really great job of transitioning by letting me sit in with my CF doctors individually. They would step out of the room and let me really kind of drive the appointment, and also helping me, letting me call insurance companies by myself with, maybe they would listen while I would call insurance companies to, do prior auth battles, or when medications needed to be, have prescriptions renewed. And so I think the role of the parent really does evolve as the kid gets older, and it's a journey. So I think another aspect that's really important too is to remember that your kid is also a kid. Yes, they have cystic fibrosis, but it's really important to do all the other, quote unquote normal kid things, build memories, have fun, go on adventures with your family and with your kid. And it sometimes can be difficult, especially when you're juggling all of these different medical treatments and whatnot. But I think trying to live as normal a life as is possible is another piece of advice that I think my parents did a fantastic job doing. There was many a story of when I was little going on camping trips with my mom and my dad, and doing medical treatments that used battery packs or these really cool new refrigeration packs that they have, or usually for diabetes, that you can use to keep medications cold for long term without access to a fridge. Just trying to do different things to try to live as normal life as one can, while also juggling the demands that CF places on you, I think is a really important part of being a parent of a kid with CF, and really any chronic illness more generally. Something else that I think is really important to keep in mind is really the role of hope in the CF journey. The life expectancy for CF has increased dramatically since when I was born 24 years ago, and surely will continue to increase with new CFTR modulators coming out and all sorts of other different types of new medications in the pipeline. And something that I think about somewhat frequently is, if I had given up hope that this current life with CF wouldn't be possible, then I wouldn't be where I'm at today, in medical school, pursuing my dreams of becoming a physician, and my relationships with my friends and my family and my partner. And so just keeping in mind that there's a lot to be hopeful for, and there's a lot to live for, and that having CF shouldn't deter you from pursuing the life that you want to have, is I think another message I'd love to communicate. So I think there's a few relationships in my life that have been really important as I think about CF. The first is my sister, who is 2 years younger than me, and she also has CF. And while nobody would, in an ideal world, wish for their sibling to have CF, my sister has been a really important person of support in my life, because we both have this common experience of having CF, and we know the struggles of balancing daily medications with the occasional IV antibiotic admission. And so having that person in my life that understands what it's like to have CF and has lived that experience firsthand has been really valuable. And I think my parents have done a great job of facilitating a healthy relationship between my sister and I to kind of bond over our common experiences. Another relationship that has been really important to me is that with my girlfriend. I've been with her for just over 2 years now, and because of the fantastic nature of the CFTR modulators, I haven't actually been inpatient since that we've been together, but she's also been a fantastic source of support through me balancing my daily medical treatments with the challenges of navigating insurance and the medical system in an outpatient context. And also my friends have been a really important point of support. I'm very open with having CF. All my friends know. I don't. It's not something that I hide. Although I respect if people make that decision that they're maybe wanting to keep that information close to them. For me, I found it really valuable for my friends to know that I have CF, and to know generally kind of what living with CF is like. And they're able to, I think, in return, be another source of support that I found is very valuable. So in thinking about what it's taken to get into a point of independence for caring for my own medical regimen, I think there's a few parts to talk about. First is the medical aspect of it. When I was little, my parents administered medications to me, and then I reached a point probably about late elementary school, early middle school, where I was responsible for doing my own medications, taking my own pills, cleaning my own nebulizers, doing the nebulizers myself, etc. And then I also think that there is the care management aspect of that, scheduling doctor's appointments, navigating insurance, those types of logistical interactions. And that, I think, is something that in some ways is more difficult to become fully independent doing, because the nature of daily medical treatments is very routine. And so while I think I was doing all of my own medications, pretty early on in life, like I said, late elementary school, I think probably is when I was fully independent. It took several years to become fully independent in, ordering medications and navigating the medical system. And I don't think it was really until college, where I moved to a different state, that I really became fully independent. I think that there's a few tips that I would give for aiding the transition of managing one's own care. I think that my parents did a great job of helping me understand the nature and the complexity of the U.S. medical system, and that as a person with CF, that's something that I'm going to have to navigate. And so I'd listen into when my parents were calling insurance companies, when they would make appointments for the CF clinic, when they were calling for prescriptions to be sent to our house. And then when I started college, it was really my job to do that for myself, because I moved to a different state. And so I think having that experience of moving away from home really solidified my own independence and caring for myself from a logistical standpoint. And it's a very valuable experience. I was the one that would go to my doctor's appointments, and there was no one else that could go with me because my parents were a couple states away. So the relationship between a parent, a kid, and a provider is really, really important. And I think is something that can take time to kind of perfect. When you're a little kid, or when you're newborn, your kid can't speak, and so the relationship really is primarily between the provider and the parent. And then as the kid gets older and has more autonomy, that dynamic changes. And so I think the big thing that I would recommend is, as your kid grows up, give them the space in doctor's appointments to vocalize their needs and their wants. And I remember, kind of around puberty age is when my parents really, would give me time to just be with the CF doctor by myself. They'd leave the room for, 10, 15 minutes, then they'd come back in. And I think that was a really great way of, giving me the space to make the appointment feel, and the relationship with my CF doctor feel like it was my relationship. But then they'd come back and, offer their insight and their thoughts and their concerns too. So that didn't feel like I was all alone in navigating, the complicated nature of CF and the medical side of it. And so kind of finding that balance of support while also giving kids the independence to care for themselves, I think is difficult, but is really important. And is something that I think good communication with your kid, asking, would you like there to be more time between you and the doctor independently? Would you like me to be with the doctor, when you're with the doctor? Would you like me to take charge of conversations, or is that something that you want to take charge of? I think is an important role in being a parent of someone with CF. I think something that my parents did a really great job of when I was, kind of transitioning from relying on them to give me my medications to taking charge of my own medical regimen, was they gave me the freedom to make mistakes. I think that there's acceptable and unacceptable mistakes. It's okay to occasionally forget to do a treatment, or to get, busy and you fall asleep, or you're busy and you can't do a dose of medication. That's just life, especially with the number of medications that a person with CF, takes. And there's unacceptable mistakes that my parents would, step in and intervene in if I was kind of going down a path that maybe was less advantageous. If I was, habitually missing treatment doses, or stopping an antibiotic early, that can be a problem from an antibiotic resistance. And so I think when I was taking charge of my own medical care, my parents gave me the freedom to mess up, because that's how you learn, right? Is by messing up. And also not stopping me from doing things that I wanted to do. There was a time in high school where I wanted to go on like a 15-day backpacking trip in another state, and my parents let me do that in collaboration with my CF doctors, of course, and helping find the way that I can take care of myself through cool ice packs, through portable nebulized machines, etc., so that I could do my medications on the camping trail, albeit at a bit modified of a frequency compared to what I would normally do when I was at home, but giving me the freedom to live my life while also caring for my own my own medical needs, I think was a really, really important step in me becoming independent, and something that I would also recommend to new parents. I think something that I would love to leave you with as parents of a newly diagnosed person with cystic fibrosis is really the role of hope that it's had in my life, and also I think the role that it should have in everyone else's. We live in a really fantastic time where new medications are coming out at a very rapid rate, and looking back, the state of CF in the 24 years that I've been alive is very different now from when I started. The amount of medications I do is a lot less. The outlook from a life expectancy standpoint is a lot more favorable, and my health has been better now than really at any point in my life. And so I think that there's a lot of hope to be had, and that the diagnosis of CF, while difficult and burdensome, also I think that there's a lot of hope to be had. I mean, I say frequently, like, of any of the rare and lethal genetic diseases to have, I do think that CF is as good as it gets in terms of, there's a lot of new medications, the life expectancy is improving, there's a lot of hope to be had. And so trying to encourage your kid to live a life that they want to have, whether they had CF or not, is super important, because who knows, I mean, CF might not exist in 30, 40, 50 years. There's no way to know.